today?
Fine, thank you.
Great. Well, thank you for coming in this morning. We're going to be doing your annual diabetic foot exam. And the first thing I'm going to do is visually inspect your foot. I'm looking for any signs of cracks, sores, blisters, calluses on your foot. I do see that you have a small callus on the side of your foot right here. That's fairly normal, but it's something that you just need to keep a close check on because we don't want that to cause problems later down the road. I'm going to look between your toes for any signs of fungus or any cracks or sores there. That looks good. Your toenails look good. I don't see any signs of ingrown nails. You need to make sure that you always cut your toenails straight across and make sure that those are smooth so they don't cause any irritation. I don't see any deformities of your foot. So visually, your foot looks really good. The next thing I'm going to do is check your circulation. I'm going to feel the temperature of your foot. That feels normal. If you ever notice a sign of temperature change between your feet, that could be an issue, possibly that the blood flow and the circulation is not good to your foot, and you could have problems with a sore of some sort or just a lack of blood flow to your foot. I don't see any swelling of any sort, no varicosities or issues with bulging blood vessels. I'm going to check the pulse on the top of your foot, and this is called the dorsalis pedis pulse. Your pulse is good. And then I'm going to check the pulse behind your ankle. This is called your posterior tibial pulse, and that pulse is also good. The next thing I'm going to do is check the sensation in your foot, and what we're looking for is to make sure that you have good sensation, because if you lose sensation in your foot or have trouble feeling, then that could be a greater risk that you're not able to feel when you develop a sore or a wound on your foot. I'm going to use an instrument called a monofilament, and I'm going to let you feel that so you know what it feels like before I press it to your foot. I'm going to have you close your eyes, and what I'd like for you to do when I press this against your foot, say yes if you feel the device when I touch it to your foot.
Yes. 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 Yes.
Okay, so your sensation there is good. The next thing I'm going to do is I'm going to take a Q-tip and I'm going to rub it against the bottom of your foot, and I want you to tell me if it feels soft or dull. Can you feel that?
It's dull.
Okay. What about this?
Sharp.
Okay. All right, so that's good. The next thing I'm going to do is I'm going to use an instrument called a tuning fork, and it's going to vibrate, and I'm going to put it to the side of your foot, and when it stops, when you feel the vibration stop, I want you to tell me that you don't feel it anymore.
I don't feel it anymore.
Okay, great. The next thing we're going to check is your reflexes, and I'm going to use a reflex hammer to do that. So I'm going to lift your foot. So your reflex is good. Okay, next I want to check your musculoskeletal strength. And I noticed when you came into the office this morning that you had a good gait. Looked like you had good strength in your legs and your feet. So I'm going to have you press with your foot against my hand as hard as you can. Okay, that's good. And then I'm going to put my hand to the top of your foot, and I want you to pull your foot towards you. Okay. All right, next I'm going to put my hand to the side of your foot, and I want you to press in that direction as hard as you can. Okay, now on this other side, press as hard as you can. Great. Looks like your musculoskeletal strength is good. There's several things I want to talk to you about as far as education. It's really important that you examine your foot every single day. You need to look at your entire foot, check between your toes, your heels, the ball of your foot. If it's difficult for you, you can also get a mirror and make sure that you look at your foot, checking for any signs of, like I said, sores or cracks. You also need to wash your feet every day. Just make sure that you always test the bath water with either your elbow or your wrist, because if the water is too hot and you have decreased sensation, then you might not be able to tell that the water is too hot and you could sustain a burn on your foot. You also need to make sure that you drive really well between your toes. You need to make sure that you have very good, well-fitting shoes that won't rub a blister or cause any pressure on your foot, because that could also cause a sore. Before you put your shoes on, make sure that you put your hand inside your shoe and feel around really good to make sure that there's not any debris, rock, or anything of that sort, because if there's something in your shoe and you can't feel it, then that could also rub a sore on your foot. Want to recommend that you do come in every year for an annual exam of your foot, just to make sure that you're not having any issues. If for some reason you do develop a crack or a sore or anything of concern, if you notice any discoloration, you need to make sure that you do contact us as soon as possible so that we can get you in for a follow-up appointment. Do you have any questions for me this morning?
I don't think so.
All right. Well, thank you for coming in.
Thank you.
Bye-bye.